all of you here today. To the community, organizations, and partners, thank you for your commitment and dedication in the fight against the opioid epidemic. To the community members, thank you for your continued support for us and our mission. To the staff, for your daily continued efforts. And lastly, most importantly, to anyone that is in recovery, thank you for your continued fight to be the healthiest person you can be. August 31st is International Overdose Awareness Day. The hope is to raise awareness of drug overdose. It's also a day for family and friends to remember loved ones who lost their life or were permanently injured as a result of overdose. A time to remember community members who have succumbed to this addictive illness. And it's a time to act on behalf of those on the throes of their addiction, but who are still with us. To show our support, I invite you all to wear your purple ribbon. Wearing a purple ribbon symbolizes awareness of overdose and its effects. Wearing these can signify the loss of someone cherished or demonstrate support to those undergoing grief. It sends out a message that every person's life is valuable and that stigmatizing people who use drugs needs to stop. People just like you and I are experiencing what has become the biggest public health crisis of our time. Fatal drug overdose now ranks as the leading cause of accidental death in the U.S. Statistics and data are shocking of those that have lost their lives to an overdose, and while the numbers are important, that isn't what brings us here today. Science journalist Paul Brudar says it best that statistics are just humans with the tears dried off. We are here today to remember the people, our neighbors, our co-workers, our children, our sisters and brothers, our friends, and our community. We have all become interconnected because of this crisis, but there is good news. The news that the number of overdoses have steadily declined and that we can continue to do something about it. International Overdose Awareness Day is both a reminder and a call to action with a focus on eliminating preventable deaths in our communities. We need to remain committed to finding new solutions and ensuring more access to effective pain management and substance use treatment to combat this epidemic. Family and friends need to be prepared to help. Our community needs to be prepared to help. Two highly effective drugs that can save lives and free people from the bondage of addiction are Narcan and Suboxone. For those that may not be aware, Narcan, or naloxone, is an opiate reversal drug that can be administered to revive a person experiencing an overdose. Without Narcan, the number of overdoses would be far greater. The prescription Suboxone helps wean people off heroin and other opiates while they remain functional in their lives. Together, we can share what we know, what we can do, and what we can change so that together we can say, not one more.
I found this poem and I really felt like it applied to this situation. It's titled The Dash. It's written by Linda Ellis. It says, I read of a man who stood to speak at a funeral of his friend. He referred to the dates on her tombstone from the beginning to the end. He noted that first came the date of her birth and spoke of the following date with tears. But he said what mattered most of all was the dash between the years. For that dash represents all the time that she spent alive on earth, and now only those who loved her know what that little line is worth. For it matters not how much we own, the cars, the house, the cash. What matters is how we live and love and how we spend our dash. So think about this long and hard. Are there things you'd like to change? For you never know how much time is left that can still be rearranged. If we could just slow down enough to consider what's true and real, and always try to understand the way other people feel, and be less quick to anger and show appreciation more, and love the people in our lives like we never loved before. If we treat each other with respect and more often wear a smile, remembering that the special dash might only last a little while. So when your eulogy's being read with your life's actions to rehash, would you be proud of the things they say about how you spend your dash?
what we're doing with the tree today. We're going to be planting the tree today to memorialize those that we have lost to overdose. It'll serve as a living tribute to their beautiful souls. And this tree will be an eternal memory that will continue to grow. So.
Sorry I have to read my notes so much, but if I don't, I go off on a tangent. So, August 28th marks the anniversary of the March on Washington for Jobs and Freedom, where Dr. Martin Luther King Jr. delivered his speech, and of which remains one of the most famous in American history. A speech that was a masterpiece of hard truths, warnings, and prophecies that struck the ear of the entire world. Although his speech was overshadowed, very young John Lewis also spoke that day, confidently stating, "For those who have said, 'Be patient and wait,' we must say, 'Patience is a dirty and nasty word.' We cannot be patient. We do not want to be free gradually. We want our freedom, and we want it now." Dr. King's "I Have a Dream" speech still rings in our ears. We must remember the continued drug war nightmare and its devastating impact, and take up the impatient John Lewis. The time has come to end the stigmatization, continue working towards a revolutionary drug policy rooted in science and compassion, and we want it now. At this time, we'd like to take a moment of silence to remember anyone in your life, friend, family, community member that we have lost due to overdose. I invite everyone upon leaving to help in the planting of the tree. A dedication to all those who have walked the hard miles but didn't make it, and to acknowledge the brick of hope it's in front of the tree, to continue our walk in bringing about awareness. You will never be forgotten.